morning friends. Today we'll discuss about important key points. Okay, so with these points you can make out the diagnosis easily. So here the first question is history of Eschar and regional lymphadenopathy and maculopapular rash. So whenever you're coming across the term Eschar, so it is nothing but it is an scrub typhus. Okay, so if you come across, there is another term like what is it, black Eschar, and there is an periphery in this, there is an edema, then it is an bacillus anthracis. So there will be a specific term called as a malignant pustule, but here it is a triad like Eschar, so regional lymphadenopathy and maculopapular rash. So sometimes they can give like there is a person went to the forest and then he complains about some of the history of any bites. Okay, so insect bite, that is probably it is a mite. So if you come across these words, you can make out the diagnosis. So second question is here the organism which usually survives in the oldest method of the pasteurization. Okay, so this is nothing but this is a Coxiella burnetii. So it usually survives in the oldest method. So in flash method it is usually get destroyed. Okay, so this is an important point, and this Coxiella burnetii is nothing but it is a causative agent for the Q fever. So coming for third, as you know, LGB. Okay, in LGB you want to remember like A, B, C, D, E and F. So A for usually the patient will be asymptomatic and sometimes there will be in bubo. C, it is for an it is caused by chlamydia trachomatis, that is in serovar L1, L2 and L3. So and then so D, it is nothing but the doxycycline, it is a drug of choice, and E, it is an histamine, that is it is an elephantiasis. Okay, that is there is a scrotal swelling will be there, or there will be a vulval edema will be there. Okay, so another it is called as a Frey sign. So you want to remember all these points in LGB, that is in lymphogranuloma venereum. So coming for next clue, it is in back pain, fever, night sweat. So this is nothing but it is in brucella. Sometimes they can also give like hepatosplenomegaly can be given, and then there is a history of the patient has taken the unpasteurized milk. Okay, so as you know, the brucella, it is most commonly transmitted by the unpasteurized milk. So coming for next question is, so atypical or walking pneumonia, and the signs will be more than the symptoms. So here what is that is so here the answer is Mycoplasma pneumoniae, but here the signs will be more. Okay, the patient will be apparently will be very normal, but on X-ray you can make out the findings. Okay, so that is why it is called as a walking pneumonia. That is a patient, he can come to the OPD by walking. That is, on looking him you can say that he is perfectly normal, but on X-ray, in your auscultation you can make out the findings. So coming for next question. So fever, chills, headache, myalgia following antibiotic treatment for the syphilis. It is nothing but it is a Jarisch-Hershmer reaction. Okay, so what is this means? It the patient who are suffering from the syphilis, so after they are taking an antibiotic, they will be producing a short apparent symptoms like fever, chills or headache. Okay, it is not only seen in syphilis, it is also seen in leptospirosis, Lyme's disease and relapsing fever. Okay, so next question is UTI in a sexually active young female. Okay, if they have given option for Staphylococcus saprophyticus, you can go with that, or if they have given E. coli, you can go to that, but I'm sure they won't give both the options. Okay, so either one of the option will be there and just you can mark it out. So coming for next question, history of vesicular lesions on the lips and the tongue, and history of bilateral painful multiple tiny vesicular ulcers. Okay, see, here I want to say this is most common in the genital region. Okay, so if you're coming across any vesicular lesion, first it is you can want to differentiate whether it is in chicken pox or it is in HSV. So here in most common in tips on the tongue, it is nothing but it is an HSV, whereas it will be painful multiple tiny vesicular ulcers in the genital region, it is HSV2. So as you know, so above the abdomen it is an HSV1 and below the abdomen it is an HSV2, herpes simplex virus. Okay, so this usually presents again vesicular lesions. So coming for next question, history of vesicular rash and then centripetal appearance. So these are the clue words. So as I told already, the vesicular rash you want to differentiate between the chicken pox and the HSV. So but here the term is centripetal appearance. So here it is nothing but it is in chicken pox. So here the rashes usually appears in the centripetal order, and there is another special point is you can see all type of the skin manifestations in the chicken pox at one time. Like you can see vesicle, you can see papule, you can see rashes. Okay. So these are the important point you want to remember. If you come across the word centripetal, it is in chicken pox. So this is the final question. Unilateral, segmental, confined to the area of skin. It is nothing but it is in unilateral rashes or the vesicular lesions. Okay, which is usually confined to a particular dermatome. Means it is nothing but it is an herpes zoster. So herpes zoster is nothing but this varicella zoster virus. So usually resides in the Gasserian ganglion, right? So once the immunity gets lower down, it gets activated. That is called as an herpes zoster. So the main feature here is this herpes zoster usually confined to a single dermatome. Okay, so that you can make out the diagnosis easily. Thank you, friends.